Good morning, all of you. I am taking a new topic, that is oral habits in children. Commonly occurring oral habits in children and their management. I deal with the following contents: introduction, definitions, classifications, prevalence of oral habits, thumb sucking, tongue thrusting, mouth breathing, bruxism, lip habits, cheek biting, nail biting, postural habits, self-injurious habits, conclusion followed by references. So to complete all this chapter, it will take another 2 more classes. Moving on to the introduction. Oral habits may be a part of normal development, a symptom with a deep-rooted psychological basis, or may be the result of abnormal facial growth. A wide array of oral habits has been subjected under discussion for many years. These habits bring about harmful, unbalanced pressures to bear upon the immature, highly malleable alveolar ridges, the potential changes in the position of teeth and occlusions, which may become decidedly abnormal if these habits are continued for a long time. Habit is an automatic response to a specific situation acquired normally as the result of repetition and learning, strictly applicable only to motor responses. At each repetition, the act becomes less conscious and, if repeated often enough, may enter the realm of unconsciousness habit. Moving on to the definitions. Maslow, he is defined habit is a formed reaction that is resistant to change, whether useful or harmful, depending on the degree to which it interferes with the child's physical, emotional, and social functions. Matheson is defined as a learned patterns of muscular contractions which are complex in nature. Other definition is given by Johnson. Habit is an inclination or aptitude for some action acquired by frequent repetition and showing itself in increased facility to performance and reduced power of resistance. According to Finn, habit is an act which is socially unacceptable. Different definitions have been given. So whatever you feel it is, you can remember, you have to mug up definitions. It is very important. Next is classification. According to William James, habits are useful and harmful habits. Useful habits are considered essential for normal function. Example is proper positioning of the tongue, respiration, deglutition. Harmful habits have deleterious effects on teeth and their supporting structures. Examples are tongue thrusting and thumb sucking. Kingsley given the classification based on the nature of the habits. One is functional oral habits. Example is mouth breathing. Second is muscular habits. Example is tongue thrusting, cheek or lip biting. Combined muscular habits. Example is thumb and finger sucking. Lastly, postural habits. Example is chin propping, face leaning on hand, abnormal pillowing. Ernest Klein, habits are divided into meaningful habits and empty habits. Meaningful habits, otherwise also called as intentional. These are associated with deep-rooted psychological problems. Example is digit sucking and lip biting. Empty habits or unintentional habits. They are not associated with any deep-rooted psychological problems. They are abnormal pillowing and chin propping. Brash is classified. The habits are as follows. One is purely muscular habits. Example is tongue thrusting and lip biting. Next is combined activity of muscles of mouth, jaws and thumb or finger inserted into the mouth. Example is thumb sucking. Muscular action combined with introduction of passive objects into the mouth. Example, pencil chewing. Muscles of the mouth and the jaw take no active part. The effects on the position of the teeth being produced by extraneous pressure. Example, pillowing habit during sleep. Mouth breathing is the example of functional disturbance. Next classification is given by Finn. According to him, habits are divided into two types: compulsive habits and non-compulsive habits. Compulsive habits are deep-rooted habits that have acquired fixation in the child to the extent that he retreats to the practice of this habit whenever his security is threatened by events which occur in his world. Example is digit sucking. Non-compulsive habits. These are easily learned and dropped from the child's behavior patterns as the child matures. Example is mouth breathing. Next classification is given by O'Brien. According to him, they are divided into non-nutritive sucking habits and nutritive sucking habits. Nutritive sucking habits provides essential nutrients. Example is breastfeeding and bottle feeding. Non-nutritive sucking habits ensures a feeling of well-being, warmth and a sense of security. Examples are thumb or finger sucking and pacifier sucking. Next classification is given by Graeber. He is divided into thumb and finger sucking, tongue thrust and tongue sucking, lip and nail biting, mouth breathing, abnormal swallowing habit, speech defects, postural defects, psychogenic bruxism or occlusal neurosis, defective occlusal habits. So any classifications you have to remember because many times they had asked in the university paper as well as internals. Next is moving on to the development of habit. So two things you have to understand here. One is instinct, other one is a habit. Whenever the newborn develops some instincts which are composed of elementary reflexes. What is an instinct? An instinct is one where the pattern and order are inherited, while in a habit the pattern and order are acquired if constantly repeated during the lifetime of an individual. At the beginning, the infant makes an effort by frequent learning and practice. Later, and the muscles start responding more readily. It has been stated that unconsciousness mental pattern of childhood develops from 5 sources, as they are instinct, insufficient or incorrect outlet to energy, pain or discomfort, abnormal physical size of parts, imitation of or imposition of others. Next is prevalence of habits. So these are the general habits they have done. There are 2 Indian studies I am discussing here. Study have been conducted in Delhi between 5 to 13-year-old children, and prevalence is about 25.5%. Among the habits, tongue thrusting is most common, which includes 18.1%, followed by mouth breathing, comprises 6.6%. Next is thumb sucking, only 0.7%, and lip biting, relatively less common. But there was no significant difference between the boys and girls. Another study conducted in Mangalore, the prevalence of oral habits are about 29.7%. Among the habits, digit sucking is 3.1%, followed by pencil biting 9.8%, tongue thrust, and highly prevalent among 3 to 6 years old about 3.02%. Mouth breathing is prevalence is 4.6%, followed by bruxism. It is given as per the age significant between 7 to 12 years. And lip or cheek biting, nail biting and pencil biting are more prevalent among girls than boys. Digit sucking, tongue thrust, mouth breathing and bruxism are more prevalent among boys. Next, moving on to the thumb sucking. So whenever you write a habit, you are supposed to divide it like definition, classification, etiology, clinical features, tests, diagnosis and treatment plan, so that you will not forget anything while writing. So moving on to the thumb sucking or finger sucking or digit sucking, all are synonyms. Definition, it is given by Gillen. Placement of the thumb or one or more fingers in varying depths into the mouth. Moyers defined it as thumb sucking is repeated and forceful sucking of thumb with associated strong buccal and lip contractions. So next you should know what is sucking mechanism. At birth, child has developed reflex pattern of neuromuscular functions called as sucking reflex. It is the first coordinated muscular activity of the infant. It occurs in the early stages of development and is stimulated in 29th week of intrauterine life. You can appreciate in the picture. In infancy, sucking is the most well-developed avenue of sensation. Infant receives and derives sensory pleasures that are transmitted from mouth to brain. It provides gratification and relieves frustration of hunger and other discomfort. Gratification is nothing but a feeling of security, warmth and euphoria. Impatiently nursed or bottle with a poorly designed nipple loses the warmth and feeling of well-being. Therefore, is deprived of the sucking pleasures which may motivate to suck on the thumb or finger for further gratification. Next is buccinator mechanism. You can appreciate in the pictures. When the child places the thumb between the teeth, there will be a negative pressure is created with the mouth and the tongue gets lowered. And there will be a pressure against the upper anteriors and a cheek pressure against the upper posteriors. Leads to increased activity of a buccinator mechanism and the absence of opposing tongue muscle force. Further leads to V-shaped maxillary arch with high palatal vault. This is the buccinator mechanism. Next is variables affecting malocclusion. So it is mainly depending on whenever the thumb is sucked, it can be positioned in varying positions inside the mouth as explained in the classification, and other fingers are most of the time rolled into a fist or curled over the bridge of the nose. The type of malocclusion seen is dependent on the following factors: position of the digit, associated oromuscle contraction, mandibular position during sucking, facial skeletal pattern, intensity, frequency and duration of the force applied. We call it as trident factors. And the subtly has graded thumb sucking into four types: type A, B, C and D. This type is seen in almost 50% of the children, wherein whole digit is placed inside the mouth with the pad of the thumb pressing over the palate, while at the same time maxillary and mandibular anteriors contact is present. This you can appreciate in this picture. Whole thumb is placed in the mouth. Next is type B. It is seen in 13 to 15% of the children. Thumb is placed into the oral cavity without touching the vault of the palate. Maxillary and mandibular anteriors contact is maintained. Next is type C. Seen in almost 18% of the children, wherein the thumb is placed into the mouth just beyond the first joint. Contacting the hard palate and only the maxillary incisors, but there is no contact with the mandibular incisors. Can appreciate in this picture. Type D. It is seen in 6% of the children. Very little portion of the thumb is placed into the mouth. Next, theories explaining the thumb sucking. Various theories have been proposed by psychologists to explain non-nutritive thumb sucking. First theory is given by Sigmund Freud based on the psychosexual theory. This theory holds that this original response arises from an inherent psychosexual drive, suggesting that digit sucking is a pleasurable erotic stimulation of the lips and mouth. An infant associates sucking with pleasurable feelings such as hunger, satiety and being held. These events will be replaced in later life by transferring the sucking action to the most suitable object available, namely the thumb or fingers. In the oral phase, mouth is believed to be an oroerotic zone. So, child has the tendency to place his fingers or any objects into the oral cavity. Next theory is learning theory given by Pellerimo. This theory advocates that thumb sucking stems from an adaptive response and assumes no underlying psychological cause and acquired as a result of learning. Infant associates sucking with pleasurable feelings as hunger and being held. Next theory is given by Benjamin. According to this theory, thumb sucking arises from the rooting reflex common to all mammalian infants. This primitive reflex is maximal during the first 3 months of life. If it persists into later life, it can lead to an abnormal habit. And this disappears around 7 to 8 months of the age. What is rooting reflex? Movement of the infant's head or tongue towards an object touching his or her cheek. Next theory given by oral drive theory, it is given by Sears and Weiss. According to this theory, prolongation of nursing strengthens the oral drive and the child begins thumb sucking. Next is etiological factors. Mainly as follows: separation from the parents, or lack of satisfaction through nourishment, or internal family conflicts, or stepmother, or school pressure, or irritation associated with tooth eruption. Socioeconomic status more frequently seen in children from families of high socioeconomic status, which is around 43%, than low socioeconomic status, which constitutes about 23%. Other causative factors are parents' occupation. It can relate to socioeconomic status. Next cause is working mother. The sucking habit commonly observed to be present in children with working parents. Such children brought up in the hands of a caretaker may have feelings of insecurity. Therefore, they use their thumb to obtain a secure feeling. Next cause is number of siblings. The development of habit can be indirectly related to the number of siblings. As the number increases, the attention meted out by the parents to the child gets divided. A child neglected by the parents may attempt to compensate his feelings of insecurity by means of this habit. Next cause is order of birth of the child. It has been noticed that the later the siblings rank of the child, the greater the chance of having an oral habit. And it was speculated that to some extent siblings may imitate one another in sucking. Next reason is feeding practices. Thumb sucking is seen to be more frequent among the breastfed children. Next is age of the child. The time of appearance of the digit sucking has a significance. For example, in neonate, it is mainly due to insecurities are related to primitive demands as a hunger. Suppose if it is seen during the first few weeks of life, it is related to feeding problems. If it is seen during eruption of the primary molars, so thumb sucking is used as a teething device. Next is diagnosis. Diagnosis is of the thumb sucking is mainly the following three, that is history, extraoral examination and intraoral examination. History. History, it determines the psychological component involved and should ask questions regarding the frequency, intensity and duration of the habit, and also inquire about feeding patterns, parental care of the child, and followed by presence of other habits should also be evaluated. Next is extraoral examination. Various key areas to be noted include the following. First is the digits. Lips. Lips is incompetent, and upper lip may be short and hypotonic. It should be noted that position of the lips at rest, whether they are held together or apart. The position of lips during swallowing should be observed. In case of chronic suckers, are frequently characterized by short or hypotonic upper lip, Relative tensions of the upper and lower lips also play a role during swallowing. Upper lip is passive or incompetent during swallowing. Lower lip is hyperactive, and this leads to a further increase in the proclination of upper anteriors due to its thrust on these teeth. Next is the digit. This you can see in the picture. Digits that are involved in the habit will appear reddened, exceptionally clean, chopped, and with a short fingernail. That is a clean dishpan appearance. It is also a viva question. Short fingernail gives dishpan appearance. Fibrous, roughened callus may be present on the superior aspect of the fingers, leads to deformation of the finger. It indicates that it is severe prolonged sucking. So you can appreciate in the picture. Higher incidence of middle ear infections, enlarged tonsils accompanied by mouth breathing habit, which is more frequent. Thumb sucking associated with other habits include blanket or teddy bear holding and fondling, ear, nose or hair pulling, and also rhythmic rocking when dessert is sucked. Now moving on to the intraoral examination. What are the effects of thumb sucking habit? There will be a anterior open bite. This type of malocclusion arises due to combination of factors. One is interference with normal eruption of incisors due to an interposed thumb. Second is excessive eruption of posterior teeth due to separation of the jaws, which alters the vertical equilibrium on the posterior teeth. That is 1 mm of elongation posteriorly opens the bite by about 2 mm anteriorly. Facial movement of maxillary incisors. That means increased overjet. Lingual movement of the mandibular incisors. Constriction of the maxillary arch and nasal floor. This may be because of the failure of the maxillary arch to develop in width due to an alteration in the balance between cheek and tongue pressures. If the thumb is placed between the teeth, the tongue must be lowered, which decreases pressure by the tongue against the lingual surfaces of the upper posterior teeth. At the same time, cheek pressure against the teeth is increased. As the buccinator muscle contracts during sucking, cheek pressures are greatest at the corners of the mouth, and this probably explains why the maxillary arch tends to become V-shaped with more constriction across the canines than in the molars. Posterior crossbite. This occurs as a consequence of constriction of the maxillary arch. The unbalanced muscle forces on the maxilla exerted by the cheek muscles are unmet by the pressure from the lingual musculature, which are normally present. While this results in a maxillary constriction, there is no restriction to the mandibular growth, eventually leading to a crossbite and the development of tongue thrust. Effects on the maxilla. There will be proclination of maxillary incisors, increased maxillary arch length, constriction of maxillary arch and nasal floor, and high palatal vault, as I have already discussed. There is an imbalance between extraoral and intraoral musculature, leads to V-shaped maxillary arch. This is the picture showing deformation of arch toward the side of the whichever the digit is sucked. That is in the right side you can see the deformation in the picture. Effect on the mandible. You can appreciate in the picture retroclination of the mandibular anteriors. Effects on the interarch relationship. You can see in this picture there will be a anterior open bite and decreased overbite. Second picture you can appreciate overbite is decreased. because these are important. Whenever the child comes to you, you can able to diagnose a case. So this picture you can appreciate increased overjet and unilateral or bilateral class 2 malocclusion. Posterior crossbite you can appreciate because of imbalance between the extraoral and intraoral musculature, and effect on the tongue, increased tongue thrust swallow. So you have to examine the oral cavity for correct size and position of the tongue at rest, tongue action during swallowing. Effect on the gingiva. Gingiva is inflamed, gingival tissues in the maxillary arch. So next I told you trident factors which are affecting the thumb sucking. So tri means 3, which includes intensity, frequency and duration. Intensity is nothing but it implies how vigorously the habit is pursued. The digit may rest passively in the mouth or may be sucked with much enthusiasm. Frequency indicates how often during the day or the habit is practiced. Duration, which indicates the number of years the habit is continued. So the trident factors are very important. They can ask you in the viva as well as in the theory exam. Next is moving on to the prevention. Prevention is mainly by proper nursing and breastfeeding. Time, allow patience for fulfillment of feeding and gratification. Bottle feeding. Holding infant during feeding using physiologically designed nursing nipple and pacifier to augment normal functional and deglutational maturation. Next, moving on to the management. So there will be assessment of 3 main areas whenever you treat a thumb sucking habit. One is emotional significance of habit and age of the child and the status of the child's occlusion. Moving on to the management, that is pre-treatment screening. It includes 2. One is a social background, the other one is school performance and peer relationship. Social background is family status of the child, whether lack of jobs or any family stress, evidence of the child abuse or etc. should be ruled out, and followed by school performance and peer relationship. Also you should ask about the teacher. And confirm habit, its etiology, duration, frequency, intensity and presence of other habits which are involved in that. And determine whether the habit is meaningful or empty. A meaningful habit, there is a cause for the habit and can be treated by the psychological approach. Suppose if it is an empty habit, there is no cause or the cause has been removed, can be treated by dental approach. Later, according to Pinkham, the management of thumb sucking is involved into the following areas like counseling, reminder therapy, reward system and adjunctive therapy. With this, I am stopping now. The rest of the topic will be discussed in the next class. Thank you.